Thank you, Count Cordia. Like other members of the House who have spoken previous to me, I want to wish the Minister very well in her role and congratulate her on her reappointment. It's a difficult position, it's a difficult portfolio, and I think the Minister will have the support of the House, I think, in all earnest efforts that are made to try and improve services for patients in this whole area. I want to compliment the Business Committee also for enabling this debate this evening. I'm familiar with the case outlined by Deputy Tobin there, and was outlined earlier by Deputy O'Hara as well, regarding the young man who presented at A&E in Galway last week. Unfortunately, he was in a position to leave the facility without having received care and attention, and subsequently died through suicide. And I want to use the opportunity of this debate to offer my own sympathies to the family of the young man. But that point in terms of resourcing the frontline services for people who present with mental health difficulties at A&E does seem to be an ongoing issue. And I would agree with Deputy Tobin, we do seem to hear about these instances quite frequently. And you know, the challenge being, I think, is that there doesn't seem to be enough of a presence at A&Es for those who can intervene in a crisis situation. And of course, the challenge being that most of the staff within A&E are quite busy and ran off their feet in any case. But when the circumstances and the consequences can result in what resulted in Galway last week, there is something that we need to look at quite carefully there. Another major infrastructural challenge is the absence of inpatient beds. The acute mental health facility in Galway University Hospital is a 50-bed facility, and the data highlights that the facility is consistently full, leading to concern of mine that it is difficult to get access to the facility. This must present a great dilemma to psychiatric teams in terms of the necessity of admission. And while there is an emphasis, and a welcome one, on the provision of facilities within the community, we must ensure that there are a sufficient number of acute beds. Ireland's psychiatric bed rate per 100,000 has declined from 78 per 100,000 in 2008 to 33 per 100,000 in 2019, and the European Union rate is 73 per 100,000, so we're some way below that, and one must be worried that the absence of acute beds are exacerbating problems within the community, and I think it's something we should look at. Many people have mentioned CAMHS services, and despite referrals for ADHD assessment and intervention being the reason for the majority of referrals for CAMHS services, children must often wait assessment and the availability of intervention therapies are limited. I think a figure of 4,500 patients or children was mentioned some time ago there as being the existing waiting list for CAMHS services. It's very likely, I think, that a lot of those would have been referred to CAMHS out of concerns about ADHD and seeking further intervention for ADHD. And the impact of not intervening at the earliest point, of course, causes difficulties and challenges in later life. I want to compliment the Minister because I know in the last year, for the first time, a service for ADHD, adult ADHD sufferers has been afforded in Galway and Mayo and Roscommon. That service is to begin this year, and I would hope it would begin soon. But adults with ADHD will cite increasing challenges in life that present as mental health difficulties. So I think we need to provide care for the adults, but I think if we can enhance the care for the children in our CAMHS services for those who present with ADHD, it will reduce the burden of ADHD as children move to adulthood. And as the point I was making, it's the most common referral to CAMHS, despite there only being 2 specific CAMHS facilities in the country that provide specialist ADHD clinics. The impact of the current system means that children referred with concerns for assessment for ADHD often must wait due to urgent cases being unavoidably prioritised. The Lynn Dara CAMHS facility, which I'm sure the Minister is aware of, and maybe other deputies aware of it as well in Dublin, recognised the urgent need for a standardised approach to assessment and treatment of children with ADHD in 2009. It was the first HSE specialist service for assessment and management of childhood ADHD, and over the past 5 years, the Admire service has developed a structured, standardised, evidence-based clinical pathway in assessment of management of ADHD. I think, John Corder, we should roll those out throughout the country. I think it would facilitate a greater service for those children, lead to better life outcomes for them, and also it would, I suppose, streamline the referrals to CAMHS in a better manner, where there would be a specific service for children with ADHD and then an alternative service for children who present with perhaps other mental health issues such as eating disorders and other such ailments. And I think it's a model we should look at expanding.
Thank you, Deputy Erin McGree.